Okay, well, why don't we go ahead and get started? Thanks everyone for joining the December Children's and Women's Research Lunch and Learn series. Would like to start by acknowledging that the land with which our work takes place on at Children's and Women's is located on the traditional, ancestral, and unceded territories of the Coast Salish peoples, specifically the Musqueam, Squamish, and Tsleil-Waututh nations. And we are very grateful for the opportunity to live, work, and learn on these sacred lands. So this afternoon, I'm really excited to introduce our guest speaker, Falla Jin, who's my colleague and a clinical research coordinator at the Clinical Research Support Unit. And Falla is also our site's clinical trials navigator with the Maternal, Infant, Child, and Youth Research Network, also known to many of us as MICYRN. Falla joined Children's and Women's in 2020 and has supported a number of research programs and projects at BC Children's Hospital and BC Women's Hospital, including mental health programs. Falla recently helped lead a new site-wide initiative that encourages nursing and allied health professionals' engagement with research. And she and Henry, a clinical research support unit research assistant, will be sharing some of the experiences and findings with us this afternoon. So I would like to turn it over to you guys.
Thanks, Shelly. I'll just quickly share my slides with everyone. Hi everyone. Thanks very much for tuning in for today's Lunch and Learn session. My name is Falla. I am a research coordinator at the Clinical Research Support Unit, and I'm joined today by Henry, who is my colleague at the Clinical Research Support Unit. So today I'll be sharing a little bit about the experience that we had talking to point of care staff members about research. And by point of care staff, I really mean nurses and allied health professionals who are mostly full-time clinicians who don't necessarily have a research role at work. So we'll share a little bit about what point of care staff think about research, what they would like to hear from the research teams, and where there could be opportunities for better integration between research and care. So if you're doing clinical research in clinic settings, which I hope most of us working at CNW are, I hope you'll find some of today's session, some of the information we present in today's session interesting. So I'm going to start off by acknowledging that I'm presenting today on the ancestral and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh Nation. And further, this acknowledgement, gratitude, and respect extends to all of the First Nations communities in BC and Canada. So just a quick outline for today. So we're going to talk a little bit about the project's background and then looking a little bit more in detail about the results of our project. And then we'll be joined with Henry to have a discussion about how we build connections with the care teams during our day-to-day work. And then we're going to go through everyone's questions at the very end. So a little bit of a background. So this work is supported by the Maternal, Infant, Child, and Youth Research Network, also known as MICYRN. Some of you may or may not have heard of MICYRN before. It is a federal not-for-profit charitable organization funded in 2006. MICYRN's mission is really to build capacity for high-quality research that would enable better health for children and mothers in Canada. So MICYRN is affiliated with more than 20 health centers across Canada, and both BC Children's and BC Women's are affiliated institutions of MICYRN. So how this project first started is because we recognize that currently there is a disconnect between research and clinical care in academic health centers in Canada. MICYRN's data shows that research teams across Canada experience challenges when attempting to involve point of care staff in research. For example, some staff are just too busy with their clinical work and have no time to be involved. Some staff don't necessarily see research as part of their clinical responsibilities and is less interested to be involved. Or some other staff believe that research could potentially affect patient safety and therefore don't always allow research teams to approach their patients. But on the other hand, we know the story is quite the opposite from the research side, as we know that many patients have a desire to be informed about research opportunities. Many are motivated to participate because it means that they have an opportunity to help others, and that provides a sense of comfort to the participants. And very lastly, in the case of clinical trials, those are the cases where research actually provides safe and effective therapeutic treatment that patients wouldn't be able to receive otherwise, and therefore should really be considered as part of clinical care. And locally in CNW, although research is part of the PHSA mandate, the reality is that integration with clinical care varies drastically from one department to another. And as a research coordinator myself, I can certainly say that I've experienced similar challenges when interacting with point of care staff during my day-to-day work, similar to what the MICYRN data have shown. So this really highlights the need for more education, more encouragement to get point of care staff to be more engaged in research and learn about what research really is. And that's where we landed on creating a short video that would be an easily accessible education materials to the clinicians about research. So we started off the video production in 2022 by interviewing families, patients, and nurses who have had experience with research. So we asked them about their views and experience with research in general. And then with the patients and their families, we asked why they're motivated to participate in research. And with the nurses who've had previous research experiences, we asked them to describe some of the rewards and challenges to be involved in research. And the interviews, the results of the interviews inform the key messages and the scripts of the final video. And we'll just take a moment to watch the video. It's quite a short one. So just give me a second.
My name is Logan Booth.
So my name is Kirsten Hedberg.
My name is Annie Kudian.
Hi, I'm Amy Watson.
My name is Vicky Go. I am one of the clinical nurse leaders in the neonatal intensive care unit.
And I am the mom of a kidney warrior.
I was born with a rare disease called, well, I call it FSGS because it's really hard to say.
I am a parent of a child with complex needs.
I'm the clinical resource nurse in the emergency department at BC Children's Hospital.
Nurses are frontline workers. They spend a lot of time with the families. I see nurses as being that bridge to help bring family into the research world.
As a nurse, we have sort of special knowledge about how to make research accessible to patients, and just that integration of taking it from what is the question we're asking to how are we actually executing the research in real life.
I think nurses play a key role in helping families, recruiting families, helping them understand, leading them to where they can find information, how they can help in research.
And if it means that you can help another family get through something easier, I think it's on us all to help each other.
Obviously, every family is different.
But I think that the nurses should let us know about it, and that way they give us the choice if we want to be involved.
So I think there's inherent value in saying to a family, like, we care about this enough because we recognize we have these gaps and we don't understand these things. It's worth researching about.
Researching our family and our son has made history now.
I've had 13 surgeries because of it, but I'm still thankful for my donor to this day.
In my practice as a nurse, day by day, I get to solve the problems that are before me in that moment. And what I really liked about the opportunity to be involved in research is to do some more upstream thinking and to solve the problems ahead of us.
No, it's like another part of my day. It doesn't really get in the way, so I don't do a lot.
When you have a sick child in the hospital, there's a lot of waiting time, and there's a great sense of helplessness.
Doing research is a way to demonstrate that we care enough actually to ask these really hard questions. I think for families to consent to be involved in research, it means they get to contribute to new knowledge that could change and improve care for future children, and I think that's priceless.
I like to have answers. Every parent does.
It's more job satisfaction. It is another way of helping families.
Having this research means that kids like mine are still alive. So I just feel like research is a very important thing and that we all need to be a part of it so that the future can be brighter for our kids.
Thank you. Thank you for everything that you've done.
Thanks, Logan.
You make me cry.
Okay. So that is all for the video. Yeah, so we finished the video production at the end of 2022. So starting early 2023, we've been running a QI project to evaluate whether watching this video could help shift staff attitude towards research at CNW. So we invited current nursing and allied health professionals at Children's and Women's to participate in the QI project. And so the question we asked is whether watching a video changes staff self-report attitude towards research. And with a pretty simple single group pre-test, post-test design. So at baseline, staff are invited to complete a demographics and also their self-report attitude towards research. And then they will watch the video and then repeat the self-report attitude towards research immediately after watching the video. And then we also ask them to provide some general feedback on the video. So in terms of our survey question selections, we have, so the final set of questions were selected from both the literature and also the results of our interviews. So it is not a standardized questionnaire, but team consensus was reached on the final set. So which includes 11 questions at the end, so nice and easy for our busy clinicians. So recruitment took place over the course of 7 months, and as you can, over more than 10 CNW departments and clinics, and you can see a comprehensive list of departments that we've been to below. We used a combination of recruitment strategies to maximize our chance of collecting the survey responses. So for departments that have a designated staff education days like NICU, PICU, and the perinatal clinic, we presented at our videos and the survey questionnaires to the staff attending the education days. And then for some other departments where we weren't able to attend their education days or departments that don't necessarily have a coordinated education days, we've done drop-ins at some of the team huddles, or we've also recruited the staff members working on the floor during less busy hours. So a lot of these strategies were successful thanks to the help of the nursing educators on the units. So big kudos to them. And in total, we've had 259 survey responses collected at the end of recruitment. So next we're gonna take a look at our demographics data. So first we separated the respondents by discipline. And as you can see, the majority of the respondents are nurses. And we also have some allied health professionals answering the questionnaires, about a fourth of the total respondents. And we had a few physicians and others who are mostly administrative staff. Next, we separate our respondents by the number of years in profession. So you can see that we have a pretty nice distribution of respondents in their early, mid, and late careers, with the majority being in the first 10 years of their profession. And lastly, we have on this slide, we have the respondents by highest education levels. Again, about more than 70% with a bachelor's degree and a combined 17% for those with a master's or PhD degree. And then next, we're gonna look at some employment data. So we have a very nice distribution between staff working at BC Children's and Sunny Hills and BC Women's Hospital, about 50-50, and a very small number of people who are working on both sites. About 75% work in inpatient unit and about 25% working in outpatient or both areas. And then lastly, about 75%, about 75% work full-time and a combined 26% work part-time or are casual staff. So altogether, our data captures a diverse sample with variabilities in their employment history and education background. Next, we asked the staff about their current roles at work. Now, this is a multiple select question, so staff may select more than one roles if they apply to them. But as you can see here, the vast majority of respondents identify having clinical duties, with only a small number of people have other roles, including research, management, or education. This is further reflected when we asked if staff have designated research time at work. So you can see here about 95% said no and only 5% said yes. So suggesting that most of our survey respondents are clinical staff without a research role, which is our target. And then lastly, we've asked staff about their research experience. As you can see here, there is a small percentage of people who've been part of a research team, have led a project before, or being part of a QI project. But these are likely done off the side of their desk, as we know from the previous question that most staff don't have designated research hours. But what's more interesting here is that there is a large group of staff who are not currently involved in research, but is interested in the future. So this suggests that even at baseline, many staff are very curious about research and would be potentially interested to be engaged. So this could be a really great starting point to have some conversations and break some ice. And we'll come back to this point later in the presentation. Next, we're going to look at the attitude data. So participants were asked to rate how much they agreed to each of the statement on a 5-point Likert scale. So first, we asked about general attitude towards research. And as you can see here, even at baseline, most staff recognize that research helps improve patient outcomes and recognize the value of research. And after watching the video, this has either stayed the same or positive attitude has increased even more overall. But things get a little bit more interesting when we start asking about more nuanced questions. So next we asked about point of care staff about whether they have safety concerns towards research. And as you can see here, at baseline, the majority of the staff believes that research can potentially impact patient safety, and it is not always appropriate to approach patients for research. So this really echoes the MICYRN findings from many different research teams that point of care staff have a protectionist attitude over their patients when they're approached for research studies. However, as you can see here, the attitude has really shifted after they've watched the video, and less people agreed to both statements. However, I will just make a note here that at time point 2, even at time point 2, there are still quite a lot of people who strongly agreed with either the statement that research can potentially impact patient safety, or the statement that it's not always appropriate to approach patients for research involvement. So these are areas we identify that maybe further conversations or education specifically about research safety needs to happen. And then next, we asked whether point of care staff see research as part of their duties. So for the first statement, day-to-day clinical work is often more important than research. You can see here at baseline, more people either agreed or feel neutral to the statement. To the second statement, all clinical staff should be involved in research. We have a bit of a variability in their responses. However, after watching the video, we can see that there is a shift in response towards the first statement, where overall less people agreed to the statement and more people disagreed to the statement. And on the other hand, on the right-hand side, there is an increase in number of people who have agreed to the statement and less people who have disagreed to the statement. So overall, more staff see research as part of their clinical duties after watching the video. And then lastly, we asked point of care staff whether research is essential for their professional development. You can see that at baseline, the majority of people already think that research adds value to their clinical, to their professional development. but also there are a few people who felt natural about it or who disagreed. And after watching the video, you can see that the number of people who felt this way have decreased. And then on the other hand side, there are a lot more people who strongly agreed to the statement after watching the video. So as a summary of the results, so at baseline, overall point of care staff held positive attitude towards research, recognized its value to clinical care, but had concern for the research, the impact of research on patients, and some staff also don't recognize research as part of their clinical duties. And after watching the video addressed some of the concerns for patient safety, and more staff recognized research as part of clinical care, as well as the importance of research in their professional development. And then also wanted to highlight that there is room still for more communication between the care team and research teams, especially around certain topics such as patient safeties and etc. And then next, we're going to just quickly take a look at the general feedback that we received from the staff members. So we asked six questions about what staff think about the video. And then the results can be summarized as that most point of care staff agree that the video shares an important message about research, and it helps create a positive research culture, and they think it'll be helpful for training new staff. And some of the comments we received from a point of care staff, and we wanted to really circle back to the research community, is the first staff said, "This video is so powerful. It gave me chills hearing the parents and child speak about their experience. The staff who shared their experience were inspiring to listen to and touched key issues that impact all of us in healthcare. They make a compelling case for supporting research." And the second staff member gave some really interesting feedback. They said that, "I think providing an overview of recent research projects at BCCH and what the outcomes were or impacts to clinical care delivery would be impactful. Hearing from this patient specifically was interesting, and I think it's important to close the gap as well between the research that's happened and underway and bringing that back to clinical staff so they are aware and understand. We're often asked to assist with research projects, collecting patient samples, etc., but aren't given any updates, insight, or indication of what the research is for, access to the published data, and etc." So where do we take these results to? So as a next step, so locally, we're going to try to disseminate the results with management teams and educators. So we're hoping that the video can be, and also additional research education materials, if there are appropriate, can be implemented long-term within each unit, the same way that we have distributed the video this time. So that existing staff or new staff joining Children's and Women's understand that there is research going on in this hospital. And then from the research teams, we would also like to encourage the teams to give regular study updates or knowledge translation activities with the clinical teams wherever possible. Just to kind of circle back on the research findings, which could be a strong motivation for staff to continue to be engaged in research and support research. Beyond CNW, we will also be sharing the results with other health centers in Canada through the MICYRN network in the upcoming years. So next, we're going to turn to our guest speaker, and we're going to have a little bit of discussion about how to build connections with the care team on a day-to-day basis. And we're going to introduce Henry.
Hi, everyone. My name is Henry.
Henry, can you tell us a little bit about your current role and which unit you've worked in? Absolutely.
So I currently work for the Clinical Research Support Unit, so the CRSU, and a lot of my time has been, I guess you would say, contracted out to physicians on the in the hospital. So I've spent most of my time in the Clinical Teaching Unit, the CTU, supporting a number of physicians with their research projects. And one of the projects I'm currently working on is called Far From Home. And with this project, we're trying to reach as many patients who have been admitted to the hospital, especially if they've come from very far distances, as very far, especially if they've come from over 50 kilometers from BC Children's Hospital. And with this research, we're trying to understand any difficulties that these families might experience during their admission. And specifically, we want to understand any out-of-pocket expenses that they have, made during their stay in the hospital. And the only way we actually do this, understanding is through semi-structured interviews that we invite them to join by consenting them to the study.
That's great. Can you can you talk a little bit more about your role, like what you do for this project, and if there is any members of the care team that are also involved, and how?
Yeah, so my role is I am the research assistant for this study, and my role involves having to consent these patients to take part in the study, answer whatever questions they might have regarding their participation in the study. And that involves a lot of things such as disclosing some details about their confidentiality, requesting to withdraw from the study and all of those. And those involved in the study are, again, the physician in charge, so the principal investigator, and I guess I would say the nurses as well, mostly because I would have to reach out to them to make sure the patient or families I'm speaking to are actually eligible to begin with.
Yeah, that's great. And when you actually do need to reach out to the nurses, how do you build rapport? Because I understand the CTU is very busy. They have a lot of staff turnovers and stuff. So what has worked well for you, and what are the challenges?
Yeah, I would say having to build rapport with, I'll actually begin by saying having to build rapport with the nurses can be very challenging sometimes, mostly because the nurses, I don't know how, if a lot of us know how the schedules work, but it's a very shifting schedules where sometimes you may come in 1 month and the next month it would be a new set of, faces on the floor. So that can be challenging, having to build rapport. But something that I found that worked for me was depending on the study, I would have to reach out to the person that might be in charge of what I am looking for. So for example, for this study, I'm reaching out to families who might be getting discharged from the hospital. So my first thought would be, who approves this discharge, right? So there has to probably be a nurse who approves this discharge. And there is a chance that this person doesn't rotate as often as the floor nurses, right? So I was able to reach out to this person on the CTU, who's an amazing nurse, and she was able to give me about an hour of her time on a day. And we basically just talked about the whole study and what we're looking for, eligibility of the families. And I think that was very important for me, starting out with this project. Because if this person isn't around, I have found that it is a lot more difficult for me to approach patient, because now I have to reach out to nurses or the seniors who are constantly changing and having to explain to them every single time about the project, but also not being able to capture as many participants as I would have if this other charge nurse or discharge planning nurse was available.
Yeah, absolutely. That's great. And is there anything else that you found that worked in terms of building research cultures on the unit that from your experience?
Yes. One thing I think that does work a lot is attending the morning hurdles with the physicians and the with some of the nurses, I guess. And I would say this has worked for me very well because, well, as I guess starting out with this project, a few months right after my I was appointed to this project, I would normally just show my face into these hurdles and, I guess nod your head on like the things that are being said, patients coming in, patients are going out, and there wasn't really a lot of room created for me to actually, I guess, share what I need to know regarding my research project, right? But only until recently I have been able to, I would say, speak up more a little bit in these hurdles, saying, hey guys, I think I would like to know if so and so patient is being discharged, and if they're being discharged, where are they from? But I think initially there was that I would say fear of having the hurdles feel like it was just for the physicians only. But much more recently, I've been able to speak up more and saying, hey, we need to know what is going on with research, if there's any updates for us. And they've been more than helpful. Like there is always a time set aside now for research to chat about their updates.
Yeah, so you felt like you were able to fit into the team huddles and just on the unit as a research assistant.
Correct. Yes. Yeah.
Okay. Yeah, that's amazing. Well, thank you so much for sharing your experience with us. Yes. And then we're just gonna quickly finish up the slides. So if you, after today's presentation, if anyone on the call are interested in engaging point of care staff on your unit, but don't know where to start, because we understand that, there is a lot of new different faces on the floor every day. We are happy to help with the experiences that we already have to waypoint or make connections for you with the contact on the unit. So you can feel free to send me an email or send an email to crsuadmin@bcchr.ca. And then we're going to open up to questions. Okay, so I see one question in the Q&A chat. So has there been any collaboration between the people on this project and the practice-based research? Yes, absolutely. When we were going around and promoting the project in the videos, we had the wonderful opportunity to go alongside with the practice-based research group as well. I think the focus in the practice-based research team is also to encourage nursing or allied health led research projects. So there is a little bit of a nuance here. So for us, we're offering opportunities if nurses or allied health professionals are interested to be part of a team, which is often the first step that people are interested in research would like to take. And then if they have like a solid idea or like to take more steps after they've had get their feet wet a little bit in the research world, then we have been able to kind of point them to the practice-based research team if they would like to lead their own project. So thank you for your question. Can I put the link to the video in the chat? Yes, I will do that.
I have a question for you, Falla and Henry. So I'm wondering if there are certain departments that you're targeting to implement this video in, and if for anyone on the call is interested in having their departments or units implemented as part of the project, what does that look like? Like, are you coming into teams and presenting this, or are you giving the video to operations? Like, what does logistically that look like?
That's a great question. Thank you, Shami. Yeah, so for every department that we have reached out and collected survey responses to, there is certainly plan to circle back the results to them. I think we're going to be doing it kind of in two separate ways. So we'll certainly take the video to operations and get kind of support to implement this long term, but also in the meanwhile, we will be reaching out to the contacts that we already have and just kind of circling the results back to the staff members. So mostly these were done through the nursing educators that we were in contact with about scheduling our education days or team huddles and stuff like that. So we're hoping that we can share the results with them and they will be able to share the results with the point of care staff members. Yes. And I know that we certainly were not able to go to all the units, unfortunately. So if there are other units that we weren't able to go to, but people would like us to implement that or reach out, we're happy to do that as well.
I have a couple more Q&A questions.
Yes. Someone asked, do you plan to do any follow-up studies about how long the impact of the video lasts on the view of clinical staff? I find that often people are happy to help with research in theory, but it's more difficult when it actually impacts their clinical practice. That is a great question. I think for the first part, for the project itself, we have certainly talked about doing follow-up studies, but I think logistically there are some challenges, but we are looking into that as an option to see if the impact of video lasted after 1 year of watching. That would certainly be interesting to find out. And then to the second point, I find that people are happy to help, but difficult when it actually impacts their clinical practice. I think that is for sure. I echo that. I think there are bigger conversation that needs to happen. For example, more support, resources and support for the clinical care team from their management, which we're hoping to target when we present this finding to management, so that they would allow staff members to take some of their clinical work time to help with research activities. But thank you for your question. And then someone also asked, have you thought of ways in which we could get more of those research outcomes better communicated back to the nurses and allied health who have been asked to support research? Great question, thank you. I think so far, what we've discussed is, I think the challenges that we've identified is that it is difficult to go back to the individual staff, point of care staff members and tell them what the research findings are, because the research takes years to, research findings could take years to be published or finalized, and staff members move around different units pretty frequently. I think one of the ways we identified is to have a closer collaboration with the nursing staff educators or allied health professional educators, and use them as a channel to reach to the individual staff members. But thank you for your question. Nadia asked, are you hoping to have allied health professional participate in research or assist RA in accessing patients? Yes, certainly. I know the video was kind of more tailored towards nurses, but yes, we are certainly welcoming allied health professionals to participate in research as well, whether they want to lead their own research project or be part of a research team and have their knowledge and expertise input in the research design. Yes. And then Olivia said, thanks so much for this. For those of us who have shared the frustration of this disconnect, glad this is very important evidence is being generated about attitude towards research, incredibly helpful. I know you mentioned dissemination to teams locally, but is there a plan to publish this, especially to potentially influence policy changes later on, such things as protected time, dedicated FTE percentage to research? Yes, you've made a great point. There is certainly a plan to publish. We are looking into that. This result, as you know, we've just concluded recruitment in November of this year, so the results are still quite fresh, but yes, we're definitely looking into publication, and hopefully that could make a change policy-wise to address some of the bigger issues. And someone said, have you thought about how we could give credit to the nurses and allied health who are helping? This could incentivize involvement a bit. That is a great question. I think for if nurses are interested to be part of a research team and they would like to take on a bigger role, it is certainly a great idea to invite them onto being part of the research team or the investigators team. But from what we've from the nurses that we've talked to so far, I think what people's preferences are really different. Some of them would like to have a bit more credit to the research that they've helped in. Others are willing to help. They just like to be more informed. They would just like to stay informed about the results and things like that. So I think having a bit more conversation with the nurses is certainly a great place to start. But great question. Thank you. Okay, I think that's all the questions.
If that is everything, then we will wrap up a little bit early this afternoon. Thank you so much, Falla and Henry, for that great presentation. And anyone on the call, please feel free to get in touch with Falla or the CRSU if you have any questions about integrating research into clinical care settings. Thank you. Have a great afternoon.
Thanks.